I want to thank all of these wonderful advocates for being here today. They're the ones who really inspire us and keep us going, and leaders like Ron and Monty and the mayor of Hartford, Luke Bronin, thank you for being here, and my partner and teammate in this effort, as in so many of our campaigns for common sense and public safety. We're here today because Congress has hermetically sealed the nation from common sense and science when it comes to gun violence. The fact is that there is no funding for research into the causes and effects of gun violence in this country, despite the spreading, overwhelming public health crisis that this nation faces. In an epidemic of 30,000 deaths a year, Congress has put its head in the sand and said there shall be no research, no funding for science, no common sense inquiry into what the facts are, which means that there are no evidence-based programs into how to stop a teenager from committing suicide, how to prevent a toddler from having access to guns, how to store guns as safely and securely as possible. These programs depend on science and common sense, which Congress has barred by its refusal to permit any spending, any money whatsoever, to go to research and science on the causes and effects of gun violence. Willful ignorance is no excuse to complicity in death. Willful ignorance is no defense in the law, and it is no defense in moral and political principle as well. But willful ignorance is the course that Congress has chosen. This head in the sand ban on funding continues to this day, even though the president has formally lifted it in 2013, and its original proponent, Jay Dickey, representative from Arkansas, a Republican, has said he disavows it. He thinks it's a bad idea. So we're here to call for a bipartisan effort to lift this ban on funding. It should be bipartisan. Senator Murphy and I have joined a number of my colleagues in writing to the Appropriations Committee leaders just a couple of weeks ago, and we believe that spending money on this cause is absolutely vital. There is a precedent here. If anybody doubts the importance of research, look at what happened with motor vehicle deaths. Just a short time ago, there was a similar epidemic of motor vehicle deaths sweeping the country. The Congress authorized research, and the result was seatbelts, airbags, life-saving devices that help prevent deaths on our highways. We can do the same thing when it comes to gun deaths. And this epidemic is equally preventable and stoppable. A gag order is antithetical to common sense. Hermetically sealing the nation from science is not only a bad idea, it is absolutely abhorrent and absurd, and it should end now. And that's why we are here to say with our colleagues and friends and advocates that we are determined to fight for funding that will go to this preeminently important public health cause. And now I'd like to introduce my partner and team member in this effort, Senator Murphy.
Thank you very much. Thank you very much, Senator Blumenthal. It's so great knowing that Connecticut has a team between the House and the Senate of one voice and of one mind on trying to learn lessons from this epidemic of gun violence across the country and try to change laws. It's so great knowing that we have a team of advocates that rallies to the cause every single time we ring the bell, both here in Connecticut and down in Washington as well. The scope of the NRA's power in Washington is truly breathtaking. It's not enough for the gun lobby to try to stop laws. in Washington that would reduce gun violence. It's not enough for the NRA to try to gut the enforcement of existing laws. The gun lobby is now trying to bury the truth, is trying to bury science. And that's what this is really all about. The gun lobby knows exactly what the CDC would find if they were to start doing research into gun violence as a public health issue. The CDC would find that stronger gun laws, keeping guns out of the hands of criminals, reduces levels of gun violence. And so the gun lobby knows that they would start to lose the fight at the federal level and at the state level if the CDC was allowed to do this research. And so at the top of their list, in addition to stopping background checks laws and to gutting the ATF, is to stop the CDC from being able to do this research. Why do we know that? Well, because research is happening every day on the epidemic of gun violence. Just because the CDC isn't doing it, there are privately funded studies that tell us the reality. One such study compared Connecticut's permit to carry law against the repeal of a similar law in Missouri. The repeal of a law in Missouri requiring you to get a permit in order to carry a gun led to a 40% increase in the rate of gun homicide. The enactment of that law here in Connecticut led to a 40% reduction in the rate of gun homicide, even when you control for all other factors and influencers. Mayor Bronin's going to speak in a moment about how important this is here in Hartford. Another study tells us that if you're a child growing up in a neighborhood with a high rate of gun violence, you have levels of PTSD on average greater than that of children who were growing up in Baghdad during the height of the Iraq War. Why? Because in many of these neighborhoods, you fear for your life every time you walk to school or you go to a friend's house, or you know somebody on your block within the last year who's been killed, a friend or a cousin or a brother or a sister. The research tells us that stronger, smarter gun laws save lives. And that's why the NRA is so desperate to stop this research from happening. Diabetes kills 69,000 people every year. The CDC devotes $170 million to research on how to eliminate and control diabetes. Asthma kills 4,000 every year, and $29 million is spent by the CDC on how to eliminate and reduce the effects of asthma. Gun violence kills 33,000 people every year in the United States, and the CDC spends nothing because of this federal prohibition. So I'm a member of the Appropriations Committee, and I asked for an appointment on that committee, the first Connecticut senator to be on that committee in 30 years, in part to help lead the fight to remove this outrageous rider. And I'm optimistic we can get it done, because at the end of the budget deliberations in 2015, there were only a handful of issues that were still on the table to be decided, and this was one of them. So one of the questions we'll get asked is, can this really get done? Well, in the end of the budget deliberations, there were a small number of issues that were left off the table. This was one of them. This came very close to getting done at the end of 2015 as part of the budget deal. And we believe if we keep up the pressure and keep up the fight, we can get it done in 2016. I'm really glad to have here one of our new leaders on the ground in Hartford fighting this fight with us against the plague and the scourge of gun violence. Please welcome Mayor Luke Bronin.
Thank you very much, Senator Murphy. Connecticut is fortunate to have two leaders, national leaders on this issue. Our senators, Senator Murphy and Senator Blumenthal, have been outspoken critics of these restrictions. We are so fortunate to have them leading this charge. As Senator Murphy just eloquently said, this really matters every single day to residents of our city in Hartford and to residents of cities like Hartford all around the country. Families and communities are devastated, every day by gun violence. And history is not kind to anyone who throws up barriers to scientific research. This is a public health problem. The scourge of gun violence is a public health problem. Our acting commissioner of public health knows that. He's been a leader in this arena. We have institutions here in Hartford, like St. Francis and others, that have dedicated tremendous time and expertise to understanding the effects of trauma, what it means for a child to grow up in a neighborhood where they see loved ones, friends, neighbors lose their lives to gun violence, and what that does to them, what that does to the decision-making process for our young people as they try to deal with the anger that that creates. We have to address this for the problem that it is, which is a public health problem. We can't do that effectively if we refuse to even let research move forward. I commend Senator Blumenthal and Senator Murphy for highlighting this issue, for leading the fight down in D.C. Anything we can do to partner here at the local level, please know we'll be here. Keep up the fight, and thank you very much.
Thank you.
Good morning, everyone. My name is Dr. Raul Pino. I'm the acting commissioner for the Department of Public Health. And I'm here not just representing myself, but also the 800 plus employees that we have at the Department of Public Health. What we don't understand is why the opposition to label this issue as a public health issue. Why the opposition to dedicate the funds to the research that is much needed. We have done it time and time again. We did it with cancer and tobacco smoking. We did it with automobiles accident. We have done it with Ebola. We are going to do it with Zika virus, which is new. Why we haven't done it with gun violence? Which is not only affect the perpetrator, the victim, and the family, but the entire community at large. From those who read in the news, from those who experience in the neighborhood. And it is a simple approach. It's surveillance. Believe it or not, we don't have in the United States a centralized surveillance system on gun violence. It's isolated, fragmented, that doesn't allow us to develop patterns and behaviors that are associated with gun violence. We need to identify what the risk factors are, as well as what protects individuals from getting involved in gun violence. And we need to develop and implement interventions that works. The evaluation of these also will help to institutionalize all the successful interventions across the country. Just to give you an example, in 2012, all deaths from 15 to 24 in Hartford were preventable. The number of years of lost life is just amounting, and now we are losing our families and our community members. We are losing the future. We really commend our senators for engaging in trying to get the funding for this in place, and we are here at DPH to collaborate with everyone who wants to listen to what we have to say. Thank you.
Thank you. We're also fortunate to be joined by two real leaders. They too are national leaders, Ron Panciero and Monty Frank, and I'll ask them to speak.
Thank you, Senator Blumenthal. You know, this all started about 20 years ago when the Center for Disease Control issued a statement saying that guns in the home were more likely to be used against another member of the household than they were against an intruder. And the percentage of suicides increased dramatically also when guns were present in the home. And as a result of that, the Dickey Amendment, which has been mentioned here, came about. That was in 1996. And even former Representative Dickey has now come out and said that, in quote, research could have been continued on gun violence without infringing on the rights of gun owners, in the same fashion that the highway industry continued its research without eliminating the automobile. It is my position, he said, that somehow or some way we should slowly but methodically fund such research until a solution is reached. Doing nothing is no longer an acceptable solution. So even the proponent of that amendment that caused this issue to be what it is today has come out against it. And you see here today some physicians, and I think physicians have really started to come forward because they are the ones who have to deal, especially emergency room hospital physicians, have to deal with this problem every day, and can't believe that even research, cannot be done to alleviate this problem that kills more than 30,000 people every year. And so many of the physicians and medical groups like Doctors for America, the National Physicians Alliance, the Doctors Council, American Medical Women's Association, American College of Preventive Medicine, the Committee of Interns and Residents, Physicians for the Prevention of Gun Violence, American Medical Student Association, and American Academy of Pediatrics are all coming forward and saying, this is absurd. We have to do something about this awful problem that kills 90 people every day. So, in short, it's past time to end the ban on research. Nobody wants bad research. All we are looking for is sound research that will reduce the 30,000 plus Americans who are killed by guns every year. It's long past time that we do this, and I thank our Senators Blumenthal and Murphy for taking the lead on pushing to get this done now. Thank you.
Thanks, Ron.
Thank you. I want to introduce my friend, Dr. William Begg, also a resident of Newtown, as I am, also a rider on Team 26. He was in the emergency room on 12/14/2012, the day of the shooting in our town in Sandy Hook. He joined me in calling for research on gun violence prevention, as has the American Bar Association and 8 national medical and public health organizations. They all call gun violence a public health crisis, which requires public health approaches to curtail it. The Center for Disease Control and Prevention and the National Institutes of Health need to be funded to study the effect of gun violence on public health and safety. Solutions to the public health crisis posed by gun violence requires researchers to gather data and develop evidence-based policies to require and to reduce the rate of gun violence injuries and deaths. Simply put, we should apply the same level of urgency and funding to gun violence research as we do to every other public health crisis. There is nothing in the Second Amendment that prohibits research into public health crisis research, such as that posed by gun violence. 3 years after Sandy Hook and more than 90,000 gun deaths later and hundreds of thousands of injuries due to gun violence, it is time to end the ban and allow the CDC and the National Institute of Health to study gun violence and provide us with data so that we can develop evidence-based policies to reduce the scourge of gun violence in not only places like Sandy Hook and Hartford, but across the country. Thank you.
Happy to take questions.
Senator Murphy, could you, I'm sorry, I missed it, the attribution for the post-traumatic stress remark?
Yeah, I could get you the attribution. I don't have it off the top of my head. That's
You didn't mention it, so I didn't miss it.
You didn't miss it. And listen, let me clarify. Listen, we can't predict where the CDC research will go, except for the fact that most all credible research that's been privately funded has pointed in only one direction, which is that gun violence is a public health epidemic, and smarter gun laws reduce the risk to children and to families. So I don't want to sound like I'm prejudging what the CDC will find, except that it would be surprising if they found something different. And my guess is that the gun lobby is fighting this so hard specifically because they know what this research is going to find.
Yeah, let me just supplement that, just to back up what Senator Murphy has said. It's a catch-22. You can't prove what you don't research, and you can have suspicions or predilections, but the fact is the lack of evidence-based policy condemns us to ignorance. The research now is that where gun laws are stronger, lives are saved. It's not purely anecdotal. There is some science behind it. There are numbers to prove it, but it is not the kind of comprehensive and authoritative research that can be done if there is funding for it. And it's done and ongoing with respect to other diseases. If Ebola were unresearched, there would be a public clamor, an outcry, and there should be about gun violence as well. And one last point on the politics here. Both Leader Pelosi and Leader Reid pressed in the last days of the last session for money in the budget. And in fact, I've spoken to both of them about it. I'm sure Senator Murphy has too. They are determined to push forward with it, and I think we'll have bipartisan support. I'm very hopeful about it.
If private funding, private research rather, is going on, then what's the importance of having to get the CDC involved? In other words, why can't you get the research on the private side?
Well, partly it's a matter of resources. The federal government has resources that are incomparable, and it can choose among the potential researchers as to their credibility and ability. So the NIH and CDC have protocols and procedures for choosing who the researchers are going to be based on their qualifications and their credibility, so that it's not just an off-the-wall kind of study, and it adds to the credence and weight of whatever study is done.
Well, and I'd add two pieces to that. It becomes a logistical nightmare for public institutions because often federal dollars are commingled with state dollars and private dollars. And so when you have a federal law prohibiting research on gun violence, you have to be very careful about where your federal dollars are and where your state dollars are. And so we saw this with embryonic stem cell research. While there was a ban on embryonic stem cell research with federal dollars, many institutions stayed away from it entirely because they didn't want to be at risk of losing federal dollars because they had inadvertently commingled two sources. Second, the federal ban sends a message that this isn't a public health problem. If the United States Congress disallows research with federal dollars, then it sends a message to other potential funding sources that they shouldn't care about this either. So there are practical consequences of this ban, but there are also chilling effects on research funded by other sources.
No, I don't think anybody disputes that guns can be dangerous on any side of this discussion about gun control. I don't think anyone makes that argument. But how can you, aside from having all guns be smart guns, the owner could pull a trigger, what else can you do? If there's a gun in a house, yeah, there is a danger. Even if it's locked up, as we found in Sandy Hook, gun was locked up, kids got to it.
Well, there's clearly so much more. As I referenced, one of the seminal studies of Connecticut's law is relative to our permit to carry law. So there's a new study by Johns Hopkins which shows that Connecticut's permit to carry law has reduced gun violence deaths here by 40%, and that the repeal of a similar law in Missouri has increased gun violence deaths by 40%. So there is a treasure trove of potential research into both the effects of gun violence on the ground floor and on policy prescriptions that is disallowed. And again, I think we need to have a better understanding of the true impact of gun violence, right? And so that's what that study about PTSD is about. Maybe there would be a greater imperative on Congress or state legislatures to do something if they understood the sweeping implications of gun violence in a neighborhood like the North End of Hartford. And so if you do more research into the after effects of gun violence, you perhaps increase the level of interest in getting something done. It's not just about the person that gets shot or his mother or father. It's about the 20 people who on average show signs of emotional trauma based off of one shooting incident. And we only know that because of private research, but public research on that fact could increase the pressure to get something done.
And, you know, the fact of the matter is that the NRA has imposed a gag order on America, on American research, that could not only illuminate but alter public policy. And even if just a few lives are saved, and many more than a few will be saved, it would be worth unleashing the researchers of America to figure out how to store guns more safely, how to manufacture them so as to be more secure when they're stolen, how to trace bullets when they're fired. This kind of research is just waiting to happen.
Well, what would
And
you do to the 300 guns that are already out, 300 million guns that are already out?
well,
Well,
that's,
it's more than 300 million. There's more guns than there are people in the country.
you know, Mark, what you don't know can hurt you. And that's an unknown that is hurting us. What do we do about them? Maybe some research into all those guns, whether they're assault weapons, what to do about them, whether they can be made safer, stored more securely, tracked down better. That kind of public knowledge, which now is barred by the gun lobby and the NRA, can help save lives. And it is absolutely abhorrent and absurd that Congress is complicit in that ignorance, that it has adopted this hear no evil, see no evil. That's the attitude. Hear no evil, see no evil. America is gagged.
I think Mayor Broden wanted to just chime in here for a second.
Just real quick, Mark, in addition to what the senator has just said, as Senator Blumenthal said, we don't know where the research will lead. It could also help us understand how better to treat those who've been exposed to violence, how to intervene in the most effective way, how to treat the effects of that trauma, and how to break that cycle. There have been some privately funded studies that have shown that gun violence in some ways mimics contagious disease. And we need to understand better how we combat that disease. So it's not just about the gun laws, specifically with respect to, common sense gun laws that our senators have been advocating so fiercely for and our governor has advocated so strongly for here in the state, but it's also about the broader problem. And that's why it's so important to talk about it as a public health problem, because it broadens the aperture, it broadens the scope of the analysis, and it brings questions up that we need to really be wrestling with. How do our emergency room physicians intervene at that first moment? How do our educators best address the trauma that their students have experienced? Those are the kinds of questions that are also barred by this absurd ban.
Mayor, on the note of what you were just saying, is it possible to hear from you, doctor? You're on the front lines of this now. Is this a public health crisis that everyone's seeing?
Great idea.
Well, thank you for the opportunity to speak. My name is Dr. Bill Begg. I'm an emergency room doctor at Danbury
Have some
Hospital.
other doctors in training, right, here with
We
us?
do. Thank you for coming.
Sorry, what's your name again, slowly say?
Dr. Begg, B-E-G-G. So, B-E-G-G. So after witnessing the Sandy Hook tragedy firsthand, I've committed my medical career to trying to address this public health issue. And I can tell you with confidence, my colleagues are ready to go and do some common sense research. Some of the best research in our country was done in the 90s. One of my colleagues, I asked, how come you still don't do the research? He said, well, I have no funding, and even if I did, I'm afraid that my institution will not employ me. Mark, one of the things you asked is what can we do with information? One of the most common things that we hear out there is that if you own a gun, you'll be safer. The preliminary research contradicts that. The preliminary research shows that if you own a gun, you are much, much more likely to die from a gun death. Either your spouse will die, or your child will die, or you may die if you become somewhat depressed or upset and commit suicide. So there's a treasure trove of research opportunities. Think about it, since 1996, what has happened in our country? We now have social media, cell phones. A lot of what I see in the emergency room, the suicides had some interaction with social media, which you didn't have 20 years ago. So there's so much research out there. I can tell you that if we do research and we're able to speak to our patients and inform them about what the risks and benefits are, I will say with confidence we'll decrease the gun violence deaths in our country.
Can we do it on the state level, or does this, I mean, obviously the majority of money will come from the federal, but on the state level, can we legally?
Well, presently, the only places that are doing research privately, University of Pennsylvania, Johns Hopkins, there's some folks out in California, but there's no nationally funded research where we can all come together, physicians, and exchange information easily. As the senator said, it's just a couple folks on their own. There's less than 10 full-time researchers in the country, at last we checked. If you look at cancer and cardiac disease and stroke, there's dozens and dozens and dozens. So we are just waiting to go to do this research and be able to educate our patients and educate our country on what choices they can make to decrease gun violence.
You can do it on a state level, but you risk running afoul of the federal law if you were to ever commingle federal funds with state funds. And so that it has a tremendous chilling effect on state institutions that want to do this research.
Yeah. Any public institution has to consider whether it wants to take that risk and possibly lose all of its federal funding. So it does impact a lot of institutions.
What can we as a public do? Anybody can answer that. What do you want from us?
Well, you're preaching to the choir here in the Connecticut delegation, but you know, we need help convincing our colleagues, and so everyone here has friends and family in other states, can join with national organizations that are trying to push this issue over the top. I think Senator Blumenthal's right. You know, this is an issue that can get done in 2016. Maybe it's going to be difficult to get a background checks bill passed in this Congress, but this came close to getting done in the final days of 2015. We need a few more champions sitting at the table this year to get this done, and people can help us win those champions all across the country.
Yeah, I think if the target group is not our delegation, but simply to use social media and all the forms of communication to, in effect, counter the tactics of the gun lobby and the NRA. Do what they do and tell Congress, we need to know. We, the American people, have a right to know. Take the blinders off. Remove the gag. Let the research go forward so we can know what the truth is. And that's a very simple message and ought to be bipartisan. Having talked to a number of our colleagues, you know, their attitude is, well, maybe we should do some of this fact-finding. It's kind of common sense. Thanks,
All right,
everyone.
Thank you, everybody. Thanks. Hey, man. Thank you very much.
You're great. Thank you. You got to come every time.